One day, now we are going to discuss another topic, which is retinal detachment. From the word itself, it's clear that it's a detachment of retina from the posterior surface of the eye. So we can see, in normal case, the retina will be attached to the eye borders, and once there is a detachment due to any tear or anything, that is known as the retinal detachment. Introducing the topic, that is, retinal detachment is a disorder of the eye in which the retina separates from the layer underneath, and without treatment permanent loss of vision may occur. The retinal detachment is a disorder of the eye in which the retina separates from the layer underneath, and without treatment it may lead to the vision loss. The mechanism most commonly involves in the break in the retina that then allows the fluid into the eye to get behind the retina, and a break in the retina can occur from a posterior vitreous detachment or injury to the eye or inflammation of the eye. And other risk factors include the being short-sighted and previous cataract surgery. And retinal detachment also rarely occur due to the ancoidal tumor, or the diagnosis is either by looking at the back of the eye with an ophthalmoscope or by the ultrasound. The main risk factors are severe myopia, that is the nearsightedness, then the retinal tears, then trauma, then family history, complications from cataract surgery, injury, and the advanced diabetes. These are some of the risk factors. In severe myopia and all, there may be because of the increased straining and all, there will be a chance for the retinal tears, and as there is a retinal tear, means once there is an injury or any trauma occurring, that may lead to the retinal detachment. That is the how it goes to the retinal detachment. And once there is a previous history of family history or the personal history, the person with the one eye tear may have the risk for the other eye detachment also. Then the complications from cataract surgery means during the surgery and all, accidental injuries are common. So once there is an accidental injury to the particular part, there may be that may lead to the retinal detachment, and due to the direct injury or due to the advanced diabetes. In case of advanced diabetes, there may be retinopathy, and because of that, there may lead to the retinal detachment. Then the activities that increase the intraocular pressure can cause the retinal detachment. Once there is an increased intraocular pressure, that may also lead to the retinal tear, and that in turn result in the detachment. And the high impact sports or high speed sports, that means once we are requiring more effort or high pressure or high energy requiring sports, means that may lead to the in-turn injury, or the pressure will be increasing, and that may lead to the retinal detachment. And the driving and skydiving, then the bungee jumping or roller coaster rides, and valvular manner, and the weightlifting. In the hope you know what is all the terms. The bungee jumping means from the height we will be putting the legs to a rope, and when jumping from a height to from a height we will be jumping downwards. That is a bungee jumping. And the other valvular manner means that will be increasing the pressure. Means valvular manners are, as we will know, in most of the cases we will be trying to avoid, or we will be advising to avoid the valvular manner, and it may result in the increased pressure, and through that there will be chance for the retinal detachment. And the weightlifting also, in case of weightlifting also, it is a high energy requiring or high impact requiring action, and because of the high impact, that may be lead to the increased pressure, and once there is an increased pressure, that may lead to the detachment. These are the different risk factors. So once more, the risk factors are the severe myopia or nearsightedness, then retinal tears, then trauma, family history, complications from the cataract surgery, injury, advanced diabetes, then activities that increase the intraocular pressure and can cause retinal detachment, and the high impact sports or high speed sports, then driving and skydiving, then bungee jumping or roller coaster riders, then the valvular manner, and the weightlifting. These are the different risk factors. Then along with that, aging. In aging means after the 50s and all, there will be increased chance for retinal detachment. Means once there is aging, there may be increased risk for developing the tears or pressure development. All the things will be increased, and so the chance for developing detachment increase as the age advances. Then previous retinal detachment in one eye. Once there is a previous retinal detachment in the one eye, that may lead to the detachment of the other eye also. Then extreme nearsightedness means all the top things. Then previous eye surgery such as the cataract removal, then previous severe eye injury or previous other eye diseases or the inflammation. These all will be leading to the retinal detachment. Then the signs and symptoms. A rheumatogenic retinal detachment is commonly preceded by a posterior vitreous detachment which gives rise to these symptoms, that is flashes of light or photopsia, very brief in the extreme peripheral part of the vision. Outer center of vision will be poor, and a sudden dramatic increase in the number of floaters, means there will be increase in the number of floaters and a ring of floaters or hair just to the temporal side of the central vision. These are the some of the manifestations. You know what is floaters? The floaters means spots in vision that look like black or grey specks or strings that drift across the eyes. Means once there is a vision problem, there may be spots in vision. Means we will be seeing something with the some of the spots. Means once we are seeing the image, the complete image will not be getting. We will be we will be having a sensation of some spots in our vision. That is the once we are looking, two persons are looking at the same image, and one will be saying that there are something else, or we are seeing some more dots or other lines in, and the normal person will not be seeing that. The person with the problem will be seeing just a dots or some lines and all. That is the floaters. Then the bright flashes of light, especially in peripheral vision, means bright flashes of light. They will be sensing that there are some bright flashes of light is there. Then the blurred vision, then shadow or blindness is part of the visual field of one eye. Means there will be some shadow or blindness. Means once there is a problem in the retina, we will not be able to perceive the image exactly as it is. These are the some of the signs and symptoms. Then coming to the diagnosis, the retinal detachment, as we already discussed, it can be identified through the ophthalmoscopy, then ultrasound, then fluorescent angiography, then tonometry, then refraction test, color vision test, visual acuity, and the slit lamp examination. Hope we have discussed all the things, and as in the previous classes itself, that is the ultrasound, then fluorescent angiography, then tonometry, then ophthalmoscopy, then refraction test, color vision test, visual acuity, and the slit lamp examination. These are the different diagnostic measures. Then the types, that is the rheumatogenic retinal detachment and the exudative or serous or secondary retinal detachment, and traction retinal detachment. These are the different types. In this picture, we can see the once there is a break in the retina, that may lead to the fluid buildup in the retina, which is broken, and that may lead to the retinal detachment. A tear with the fluid accumulation, that is the rheumatogenious. And in the traction or exudative type, there will be collection of the fluid behind the retina which is not broken. That is the means once a weight will be once there is a balloon and filled with the water, there will be some amount of traction. That is the traction type of exudative. And once there is a tear in the balloon, means that there will be some traction, and the fluid, some amount of fluid will be leaking also. That is the rheumatogenious. Simply we can understood through that. So we can discuss one by one. One is the rheumatogenious or retinal detachment. The rheumatogenious retinal detachment occurs due to a break in the retina called a retinal tear that allows the fluid to pass from the vitreous space into the subretinal space between the sensory retina and the retinal pigment epithelium. So it's clear that once there is a tear in the retina, that allows the fluid to pass from the vitreous space into the subretinal space between the sensory retina and the retinal pigment epithelium. And the retinal breaks are divided into 3 types, that is holes, tears and dialysis. Holes means some means minute injuries and all, or through the diagnostic or surgical procedures there may be chance for the holes in the eyes. And next one is the tears, means once there is a once there is a tear formation in the eye, that may also lead to the through the surgery or through the accidents or injury, there may be chance for the retinal tear, and that may lead to the formation of the tear in the retina will lead to the accumulation of fluid in the retina. Through that there will be some formation of the pressure, or the traction will be there, and that may lead to the detachment of the retina. Then the retinal dialysis means a tear in the retina whose anterior edge is the ora serrated and whose posterior edge is attached to the vitreous base. Means there will be some attachment between the portion of the eyes, and that may lead to the formation of tears will be accumulating, and that may lead to the some amount of pressure formation will be there, and through that there may be some traction effort, and because of the traction effort there will be detachment of the retina. That is the chromatogenous retinal detachment. Then the exudative or serous or secondary retinal detachment. Exudative retinal detachment occurs due to inflammation, injury or the vascular abnormalities that results in fluid accumulating underneath the retina without the presence of hole, tears or break. There will not be any break in the retina, but there will be accumulation of the fluids. That is the exudative or serous type retinal detachment. It may be caused by the growth of tumor or the layers of tissue beneath the retina, and namely the choroid, and this cancer is called choroid melanoma. Then the traction retinal detachment is a traction retinal detachment occurs when the fibrous or the fibrovascular tissue caused by an injury, inflammation or the neovascularization pulls the secondary retina from the retinal pigment epithelium. Because of the development of the fibrous or fibrovascular tissue, that may caused by an detachment occurs when there is a fibrous or fibrovascular tissue accumulation due to any injury or inflammation. That may inflammation or the neovascularization. Neo means new vascularization will be developing, and that will be leading to the pulls the secondary retina from the retinal pigment epithelium. That is the traction retinal detachment. These are the different types, and treatment mainly there are several methods of treating a detached retina, and each depending upon the type of the retinal detachment. That is one of the option is cryopexy and the laser photocoagulation. The cryotherapy means we are freezing we are doing the laser photocoagulation used along to wall of a small area of retinal detachment, so that the detachment does not spread. Means once there is a small retinal detachment, we have to focus on the particular tear, and by using the laser energy we have to clear the specific or correct the specific problem, and it will be helping to avoid the spread of such a detachment. We will be using the light rays, and by that we will be doing the laser therapy. Then the scleral buccal surgery. The scleral buccal surgery is an established treatment in which the eye surgeon sews one or more silicone bands to the sclera. By using the silicone bands, they will be sewing the retina detached layer to the posterior surface, and by that we will be correcting the particular problem. That is the scleral buccal therapy. We are suturing the detached portion to the vitreous traction, and we will be avoiding the or removing the traction. Then pneumatic retinopexy. This operation is generally performed in the doctors and offices. Means pneumatic means something we are using the air bubbles, or we will be using the air along with the laser therapy and all, and through that air we will be